All right, I'm going to go ahead and get started. Looks like we'll be a nice, small, intimate group. So if you've come with questions, it looks like we'll have plenty of time to answer them. So welcome, everyone. My name is Patty Holland, and I'm an assistant professor of the practice here at the Mindfulness Center at the School of Public Health at Brown University. And then I'm an assistant director of mindfulness education here at the School of Professional Studies. And the School of Professional Studies is where our education programs sit. So both our public programs, the MBCT and the MBSR programs, as well as our teacher training programs. So it's good to have you here. Hi, Maria. Thank you for putting your camera on. Vivian, welcome. Good to see you. Sahana, welcome. Avisha, yeah. Good to see everyone. So let me make sure that everyone's in the right place. So we're here to talk about mindfulness-based cognitive therapy, MBCT, and the teacher training program in MBCT. Is that correct? Thumbs up. Great. Some of you may also be familiar with mindfulness-based stress reduction, MBSR, and maybe you have questions about which program. Thanks, Robert, for letting me know you can hear, and thanks, Sahana, for letting me know that you're driving. Yeah. Just want to make sure people can hear for questions. So how many people are familiar with MBCT? There's like, yeah, a little bit. All right, so let me talk a little bit about the program itself, and then I'll talk about the teacher training program, yeah? So mindfulness-based cognitive therapy, for those of you that aren't familiar, is not a training to teach mindfulness as part of traditional cognitive behavioral therapy. Sometimes that's what people think. MBCT is a group-based modality. It's an evidence-based, group-based modality, 8 weeks, 2 hours. We offer it at 2.5 hours. I'll talk a little bit about the origins of the program. And so that's the program that we train to teach. And it's built on the frame of really one of the seminal mindfulness-based programs in the West, mindfulness-based stress reduction, MBSR. And it would be considered the first adaptation. MBSR started in the late 70s with Jon Kabat-Zinn, has 40 years of research on it. MBCT was developed by 3 experts in the fields of depression, cognitive therapy, cognitive science, and research. And MBCT was part of an original research study and program. And so that's built on the frame. I'll talk about how that came about. And that's about 30 years old and has a strong body of evidence behind it as well. So I just want to make sure we're all talking about the same thing. So those of you that are familiar with MBCT, if you care to choose, how do you know about it? Or maybe you've taken the program. Yeah, Maria, thank you.
Okay, so I'm currently finishing a master's degree in psychology at American University, and yes, we learned about CBT and also I did a project about MBCT as one of my examples in my class. So yeah, I'm very familiar with meditation as well and
Great.
practicing.
Yeah. Yeah. So that was my next question. So how many of you are familiar with mindfulness? Welcome. Is it Katrine? Katrine? Yeah, welcome. So Jean, so you were originally talked to about MBCT, so we can talk, yeah. So, and how many people consider having a personal mindfulness practice? Yeah, great. Okay, great. Yeah, thank you all for sharing. So MBCT really is, it brings mindfulness in. So it's basically a mindfulness-based approach. So let me talk a little bit about the MBCT program, and then I'll talk about the teacher training program. Yeah? So as I was saying, Jon Kabat-Zinn in 1979, I'll start with like the history, developed mindfulness-based stress reduction. Really wanted to find a way to bring the practices of mindfulness to a wider audience, and really saw MBSR, mindfulness-based stress reduction, as a public health initiative. He really saw it as a way to shift the bell curve for humanity in terms of health and wellness and how they take care of themselves after the benefits that he had been experiencing and many other people had been experiencing from various mindfulness practices and from working with our experiences in the way that mindfulness supports us to do. So one of the things that John did, among many wise things, is he immediately started researching the program. He developed it in 1979. He brought it to the University of Massachusetts Medical School, where he was working, and in essence said to the docs, bring me people that you don't know what to do with. And they pretty much sent him most of the individuals with chronic pain. This is back in 79. And so they set John up in the basement of the hospital where he started to lead the program. And he started to research the program. And so fast forward about 12, 13 years, and 3 experts, like I said, in the field of depression, cognitive therapy, cognitive science, and research were looking to find a way to bring a group-based extension of what people were experiencing through CBT. By this point, CBT was really well established, and the evidence and the support for supporting people with depression was really well established. And they were really looking, based on their research about recurrent depression, they were really looking at a way to support people to develop 2 key skills: the capacity to work with one's attention, so gaining attentional regulation, and the capacity to decenter, to be aware of one's experience, but sort of be stepped aside of it so that you can be having more of an observational stance. So not dissociation, not suppression, not repression, but being part of it. So those of you that might be familiar with acceptance and commitment therapy, which is considered a mindfulness-informed program, it's similar to the concept of cognitive diffusion. And so they went to the Center for Mindfulness and they met with John Kabat-Zinn because the research on MBSR was already coming out. And they sat in on a couple of classes, but not the full program. And they liked some of the basic structure. And they were clear that mindfulness was the mechanism that could support people to develop these skills that they felt through the research would really support a decrease in the intensity, frequency, and duration of recurrent depressive episodes. MBCT was initially designed and looked at for recurrent depression and has since expanded to mild to moderate depression and also anxiety and other circumstances as well. So they went back and they designed a program. They didn't, and they didn't get the results that they wanted. And they weren't quite sure that the teachers themselves needed to have a mindfulness practice. So they went back and they actually took the entire 8-week program. And there they really noticed that how individuals were experiencing and being trained to experience the different aspects of their relationship. So those of you that are familiar with mindfulness know that we can look at our experience by thoughts, body sensations, and emotions. In MBCT, impulses to act or behaviors are added as a 4th component because there is such a habitual experiential avoidance of that which we don't want, automatic. And that people are smiling. People recognize this either personally or with individuals that you serve or support. And so what was recognized was the way that we might be avoiding these circumstances, particularly our mood states, may in fact be what's triggering them or keeping them in place, exacerbating them or making them go longer. So they were really looking for a way to try to interrupt and interfere this. So they came back and they took the whole program and they realized a couple of things. They were convinced that mindfulness was the mechanism that they were looking for. And based on how the teachers were responding and really genuinely curious and interested in experience, all experience, not just experience that they wanted. So different from psychotherapy, there's not this working actively with thoughts. So as in CBT, we might work to restructure or reframe. In a mindfulness approach, we respond very differently. We start to encourage people and train people to experience thoughts as, in essence, mental events. Can we be with experience without getting so caught up or diffused in them? And for those of you that are clinicians or counselors or therapists in the room, people familiar with DBT, I share this because I love just kind of what a small community it is. So around the time that they were developing this program, so the three developers of the program, Mark Williams and John Tisdale, they're in the UK. At the time of the development, one was at Oxford University, one was at Exeter University, and Zindel Siegel is up at the University of Toronto. And Zindel got a MacArthur grant to study the program and develop the program. So the program was based on under that. Marcia Linehan, who had already developed. Can you not hear me, Maria? Yeah. Marcia Linehan, who had already developed DBT, was at Oxford University doing a postdoc fellow, I think. She heard about what they were doing. And so she, in essence, says to John and Mark, what are you boys up to? And so they shared what they were looking at in the grant. And she's like, oh, you are definitely looking at the mechanisms of mindfulness. So they went back and they took the entire 8-week program, and they realized that that was in fact what they were looking for, and that the structure, the 8 weeks, the way that the program systematically trains in various mindfulness practices. So we start with practices such as a focused attention and the body scan. We move to mindful movement because of the role that sensation and the body plays, because especially for people with challenging mood states, so in their head, trying to get them into their direct experience as another way of standing and being with our experience and interrupting some of the proliferation of thinking and rumination that might go on. And so we look at and then we also have brief practices in MBCT. So they took the MBSR curriculum and then they inserted into it very simple cognitive activities that are intended to be facilitated as awareness practices, but to support people in really understanding the nature of the mind in general and their mind in particular. Really looking at how automatic thoughts arise and how they arise without our thinking, looking at the connection between, one of the things the research was showing and continues to show for recurrent depression is a slight change in mood, whether it's waking up and feeling a little low because it's a cloudy day, or just a slight change in mood can trigger a cascade in negative thinking that, if left unnoticed or not attended to, can quickly lead to a downward spiral. The same is true that the presence of a familiar thought pattern can trigger a change in mood. Similar mechanisms that are seen in some aspects of anxiety. So they injected a few exercises throughout the program from a cognitive perspective. So for example, we don't necessarily in MBCT teach about cognitive distortions. I might use that word, but I might not use that word. We do, however, have one session where we're looking at the territory. We're exploring aversion, and we're looking at the territory of anxiety and depression. And I might put up on a flip chart of the screen common thoughts that people have when they experience these mood states. And so already we're sort of decentering from it because we're looking at them. And then we ask people, in essence, like, using different strategies of familiarity and humor, like, what's your top 10 hit parade? So we ask people to start identifying. Often people connect, wow, other people think the same thoughts. We explore, what do you make of the fact that we know these thoughts so well, that they're shared? We also notice in the room that the mood immediately drops. So we explore experientially from a mindfulness perspective, what's happening now with us, just even thinking about these thoughts, helping people start to see the connection. And so the aim of mindfulness, the aim of MBCT really is not just to interrupt and improve this cycle of recurrent depression, which is very strong evidence for, but it's really intended to support people to relate differently to all experience. An example I share from one of my early classes that for me sort of highlighted the possibilities is, I had someone in my class and he had a very lengthy history of depression. He had a couple of episodes that involved hospitalization. He was relatively stable at the time, some residual symptoms, but he was participating in the class and really engaged. And around class 5, he started to get quiet. And then in class 6, we're sharing, we were doing something and he got quiet and then he just started crying. And so instead of moving in to try to understand or fix or whatever, we all just sort of held space for him and really checked in with what he was experiencing. And so as we did this, what he shared was that he realized a couple weeks ago that he was starting to recognize through his mindfulness practice, early signs of when depression might be happening. And that was really disheartening for him because he never wanted to experience that again, right? Of course, who would want to experience that again? And he got quiet. And then he said, but the thing is, I was going out the other day. I can't remember where he was going, but he was getting into his car and he said, and I happened to look at the tree, excuse me, in my neighbor's yard. And as I looked at the tree and the way the light was hitting the tree, he said, I noticed a few things that I might not have ever noticed. I noticed that a smile had formed on my face. He said, I felt that. I noticed that I had the thought, wow, that tree looks really pretty. And then he said, it would have never occurred to me that I could experience moments of joy and depression at the same time. Right. So here's a broadening of our perspective. And then he was able to take different action. So we engage in systematic training of mindfulness practices, and then we use this arc of content to explore using our practice as the laboratory. So we look at the difference between autopilot and being awake or aware. We look at living in our heads and the tendency we have to live in our heads, both through practice and through some cognitive activities and other activities in home practice. We look at how to gather the scattered attention. And in this session 3, there's a lot of body awareness practices, giving people other places to stand in their experience, recognizing sometimes that it's easier to work with a body and some of the sensations in the body than it is with the mind. We look at recognizing aversion. So one of the things about this program and MBSR, given how mindfulness is talked about in the mainstream, is people often come to classes wanting to come to their happy place. It's like, oh, I really need this tonight. I need to be relaxed. I need to come to my happy place. And sometimes I'll say to the class, oh, I'm sorry, we're kind of not going to go there tonight. We're going to explore what it's like to be with difficulty. So there's a little bit of exposure that goes on as well. And then we look at exploring thoughts are not facts. We look at this way of allowing and letting be with our experience, and how when we can start to relate to our experience differently, that actually might allow for new and different ways of actually taking better care of ourselves. And then we actually look at nourishing and depleting activities. We look at early warning signs and developing plans for taking care of ourselves. So it's this mix of mindfulness practice, investigation, and exploration into our mindfulness practice as we're exploring the content and our well-being through this structured program. And it really is scaffolding building. Like, we wouldn't get to class 4 where there's a practice of introducing a difficulty without having worked with individuals, gaining their confidence and their competence in working with their attention in different ways, in being with their experience in different ways, and having a different way of relating to their experience. So I'm going to stop here a lot and just see if there's any question on the program. No? Want me to go on? Yeah? Okay, because you're like, just let me know about the teacher training program. I will say the prerequisite to the teacher training program is to take the MBCT class personally. So, and it doesn't have to be with Brown, but you're welcome to take it at Brown. So our 8-week MBCT program is open to the public. So because we're an international training entity, we often get a lot of individuals into the class that are interested in learning about it and seeing if they want to train to teach it. Also, and this may be true for you, it may not be true, working in the helping professions, working in healthcare, working as a counselor, working as a therapist, can be really heavy at times. And so we ourselves might experience times of challenging mood states. And so it's also intended to benefit you personally. So you take the class personally, and that allows you to have lived experience with the program, focusing on your own mindfulness practice, on your own well-being, and looking at through the light of the curriculum. And you also then will gain really important information about what next steps you want to take. You might finish the program and be like, that was great. I might refer my clients, but either I don't have a group practice myself, or this isn't the type of program I want to teach. And so you wouldn't enter the training program. Really good to know before you put out a lot of your resources, your time and your financial resources and your energy. And then as I explain the pathways, there's different credentials, and there's different ways that you can work with it leading to certification. So first steps for the prerequisite: take the course personally, have some professional experience working with and supporting individuals that live with challenging mind and mood states. The research for MBCT is so strong that in the UK and Canada, it's in their national health services as treatment is normal for mild to moderate depression. So we're not anywhere near that yet in our country. In our country, people that are teaching it are probably, like, for example, using the group therapy code if they're billing for it, or private pay. And then the research was originally with recurrent depression. So the early studies really showed tremendous efficacy, especially for people that had 3 or more episodes of depression. And when you know about research, when there's a higher level of the condition that you're looking at, chances are you're going to see a higher level of improvement or impact. So since then, over 30 years, MBCT has also been looked at for current depressive symptoms, but really more mild and moderate. It's a 2 or 2.5 hour program. There's the need for a capacity to be able to engage in some way with the capacity of the cognitive components. We do adapt and modify the mindfulness meditation practices for people as they might need. And this is not just for people with depression or anxiety. I have a lot of people coming to the class saying, yes, I have a practice. I'm like, how often do you practice? I'm like, I use Headspace 5 minutes a day. I'm like, we're going to practice for 30 minutes a day. Right? So that the training is a little bit different. So you need to take the course, you need to have professional experience and a graduate degree in one of the helping professions. If you're someone that works in the substance use field, often that doesn't involve a graduate degree. The certification often involves a bachelor's, and so that would be accepted. If you're like, wait a minute, I'm wondering if I have this work experience and I have this education experience, and I want to know if I qualify because I really want to train to teach this, because you might have something maybe different from what I'm saying. Maybe you're not working directly as a therapist or a counselor or in healthcare or in education. Then I'm going to put my email in the chat, and we can have a set a time to meet. And I'm happy to talk with individuals about their personal experience, professional and educational experience, to see if it's a fit. So you've got my email. So any questions on that first? Welcome to those of you that joined. It's good to have you here. Also, this is being recorded, so if you came late, just know you'll get the recording as well. All right, so let me share my screen. Talking a lot. Really want to stop. Any questions? No? Okay. Can everyone see this graphic? Yeah. And let me stop. And let me try. Has anyone been to our website? A couple of people have been to our website. Okay, so I wanted, if you, I'm going to start there actually. Can you now see the website? Yeah, okay.
Yes.
Sometimes when I switch. Great, thank you. Sometimes when I switch. So if you come to our website, so it's the Brown University School of Professional Studies. Come under academics, mindfulness education, And then if you scroll down, you can get to it two ways. These short programs are the actual course. So for example, if you wanted to register for the MBCT course, you could do that here. But you can either come over to, on the left side here, Mindfulness-Based Cognitive Therapy Teaching Certificate, or you can scroll down to MBCT right here. So this gives you information about the program. And so where I got to is I went to curriculum. Yeah, it's like, I feel like we need to leave breadcrumbs or like a very good map to this.
Mm-hmm.
Yeah. So let me so here's the graphic back up. So this is the first half of the certificate program. So if you read in our literature, we say that it might take 2 to 3 years to complete the certificate program. You could actually be teaching the program. In fact, you would have to be teaching the program probably within 6 to 9 months. So I'm going to walk you through the first part because this is the part that gets you teaching, and then I'll walk you through the full certificate program. So this is what I was just talking about, the requirements. So you need to take the course personally. You need to have some experience with CBT because we don't teach it. So we expect that people will come in with some understanding. So this could be part of your academic training. It could be a professional workshop that you took. It could be that you personally have received CBT. So again, if you're not sure if you meet this, we can meet and find out. We just want you to have some understanding. And while it says 2 years of personal mindfulness practice here, so it's not teaching, this is a personal mindfulness practice. While 2 years is preferred because this is a mindfulness-based program, so the main mode of intervention is mindfulness, 1 year practice is sufficient.
Okay.
So, John, do you have a question?
Well, I'll get back with you on that one because I'm already a counselor, and I use that in my current practice, and I was trying to figure out how I can get that on there as far as continuing education. That's where I was coming from.
Yeah, right now, I will say right now, our programs do not offer CEUs or continuing education credits. What we can supply that people have submitted is we can supply for our training programs, like a course syllabus or outline, course objectives, contact hours. We can supply the information that you would need. We could do that for both the 8-week course itself, although recognize that the 8-week program is not intended as a training program. You're training in mindfulness, but it's really meant for a personal experience. But we could give you a letter of completion that you could submit for CEUs.
Oh, okay. Well, that's something I'll be looking at because I'm already practicing it, and I just want to get. I want to go through the whole program.
Okay.
But I'm just trying to figure out exactly how it would fit in since I've been doing some. That's what I thought.
Yeah. So again, it's not simply bringing mindfulness into a CBT practice. It's the training to teach the actual program. Yeah.
Gotcha.
Yeah. And thanks, Anne. Anne realizes she wanted to look into MBSR. So the first training program then is once you meet these criteria, and really it's taking the program for many of you, you take the first training program, which is called, so the gray are the classes and the red are the credentials at the end of the classes, just so that you can understand this graphic. So the first class is MBCT Foundations. This is after you take it. I think when you're thinking about your time, if you're interested, this is the heaviest lift time-wise.
Okay.
Because you're in a class twice a week. You're back in a second MBCT class as part of the registration fee for the foundations. And then just the trainees are in the training seminar on another day or night of the same week for 3.5 hours. We use our lived experience in this second class as a way to start diving into and unpacking the curriculum of the MBCT protocol and the MBCT program. We explore it from your personal experience, and then we go session by session. What's the aim of session 1? What are the practices? What's the theme? What are the key teachings? What are the activities? So we'll go through each session, And then we'll start to look at this arc that I was talking about so that you can start to see the scaffolding that happens in the program. What are we doing in sessions 1, 2, and 3 that prepare people for sessions 4 and 5, where we're turning towards aversion and working with allowing and letting be our experience, even the difficult ones. And then we move towards 6, 7, and 8, where we start to take a look at how do we best take care of ourselves? How do we perhaps recognize early warning signs early that will allow us to intervene earlier on our behalf? After this, and this is a 10-week program because it tracks along with the MBCT class. After this training course, you're a mindfulness facilitator, so you'll receive this Credly badge. And what that confers is you're able to teach introductory programs. You might, because you will have done a deeper dive into the curriculum and some of the research into the program, you might be able to develop maybe shorter programs. Maybe you're like, oh, I don't know if my clients are ready yet for 8 weeks, 2.5 hours. And so some people pause here for a while. And then say you're like, nope, I want to keep going. I want to continue to train. Here we have these prerequisites of teaching 3 introductory programs. These are really more of a strongly encouraged and not a prerequisite. We talk about these in the foundation class. It's a way to help you do 2 things. Start to prepare to teach mindfulness publicly or to your clients or to your colleagues if you've not done so. It also is a potential marketing strategy for your MBCT class. So then the next the next training course is the teacher advancement. And we offer this once a year. And Zindel Siegel, who I shared, was one of the founders. And I trained with Zindel, and Zindel has consulted with us on our training program. And Zindel joins me and teaches in this program with me. So we just finished our TAI this week, actually. And the next one we're hoping will be in May. After you finish this course, it's a 5-day training. It goes Friday night, Saturday, Sunday, Monday, and Tuesday until about 1. And really your time here is spent in teachbacks, teaching the different components of MBCT, learning from one of the founders of it, so that at the end you feel more confident in being able to deliver the program. And so after this course, you're a qualified MBCT teacher and you start to teach the program. You can generate revenue. Now, what I say is you don't have to market yourself as a qualified MBCT teacher. You can just say you're an MBCT teacher trained through Brown University, if that's important to you. You can't yet say that you're certified because you've not completed the certificate program. So, for example, if you were to start, if you haven't taken the MBCT course yet and you take the MBCT course in the summer, and then you want to continue and you choose to take the foundations in either the fall or the winter, early spring, you would take the TAI and you would be teaching. So that's level 1. So before I go on, I'm going to stop here and see if there's any questions.
Oh, I don't have any.
Okay, so John doesn't, but it looks like Rebecca does and Maria.
Yeah.
Okay. Go ahead, Marie.
Sorry.
Go ahead.
Are these classes virtual, all in virtual,
Yeah.
or in person?
They're right now, our training program is international, so our training program is online, live online, not recorded. And the MBCT class at Brown is also online.
Okay. Okay, there's no option to go in like a weekend part of the course or no?
Not yet, not
Okay.
yet. If you're local to the Rhode Island area or to the Brown area, or so it would be New England, as part of both the MBSR and MBCT class, between weeks 6 and 7, well, 5 and 6, the way we offer it, there's an all-day silent retreat. It's an opportunity for participants in the program to dive deep. So we do offer one of those days in person. So if you're local, you can come in person for that.
Okay, perfect. I saw that and I was just wondering if that would be an option. Great,
Yeah.
thank you.
Yeah. Yeah, Rebecca, please.
Okay, so my question was just about, as a mindfulness facilitator, you said that we'd be able to teach intro sessions or to hold intro sessions. What is an intro session in this
Yeah,
context?
it's like an introduction to mindfulness, and you might want to introduce mindfulness as a way is how does this support mind and mood states, right? You might want to use it with the with the content from the MBCT program. So in the foundations program, you'll practice guiding and receive feedback on the key practices that we do in MBCT. So a body scan, a focused attention, mindful movement. In MBCT, there's a very brief practice called the 3-minute breathing space. So you'll guide that. It's a specific practice in the program. And then there's like an interactive, like 20 minutes of what is mindfulness and a focused attention that you might offer in an introductory program. So often people will, and we'll help you like map that out. So what might an introductory program look like? It might be something you want to do for clients. It might be something you want to do for colleagues as a way to both take care of them, but also introduce them. And so these are usually like an hour and a half long, and just a way to start to guide practice. As the mindfulness field grows, our colleagues at Oxford University and Bangor University in the UK developed an instrument called the MBITAC, the Mindfulness-Based Intervention Teaching Assessment Competency. Maybe you're aware that there's a lot of mindfulness teacher training out there, right? Some of it is really, really good. Some of it is really, really bad, right? So as the field has grown, and in Oxford and Bangor, they have a master's degree in mindfulness. They developed an instrument in 2014 that looked at 6 core competencies of teaching group-based mindfulness programs. Brown University, we now work with them on both adapting the tool. I was working with some clinicians in the UK adapting it maybe for individual modalities. So it's just the way that because many people that come to MBCT, for example, many of you have training in your fields. You have training as clinicians. And some of what happens in a mindfulness-based program is you're going to be responding differently. There's an expansion of how you might respond to certain things in a psychotherapy session is very different than how you might respond in a mindfulness class. So we work with that instrument so that you feel you can safely guide practices. We also know a lot more about adverse experiences that people may have. And so really bringing trauma sensitivity also into it. In the foundations class, we touch on the underpinnings that support all mindfulness-based programs. So we look at the contemplative practices and methodologies. We look at the current research. We look at experiential education, because these programs are intended to be experiential, not, while there's didactic components, not completely didactic. We look at group process. And we look at the frames of trauma sensitivity and diversity, equity, inclusion, and belonging so that the programs can be delivered to a diverse population. Yeah, so more than you asked, Rebecca, but any other questions? Yeah, Maria, please. And then
you speak
Katrina.
about, yeah, you mentioned trauma, and I'm just wondering how you consider this modality to be for people suffering grief.
Yeah, because grief is a very unique form of sadness and depression, right?
Yeah.
So there has been some research with grief. And so I think the mechanisms and the process is the same. People would be talking about grief in the class. Where the trauma sensitivity comes in, for example, is in mindfulness. Very often an initial practice is awareness of the breath. Yeah. Focusing on the breath. And what we know is for some people, and it's sometimes, the breath is not comfortable, right? And it is not, it can generate anxiety actually. And so we introduce a focused attention that allows for other possible anchors for attention, grounding in the feet or the hands or sound outside of yourself. We talk about how to lead the body scan in a way that might be supportive for someone that might have a trauma history, including adapting the practice in some way. So a little bit broader than what you were asking, Maria, but yeah.
Thank you.
Yeah. Yeah, Rebecca, please.
So a question for you. I just finished up my second round of MBSR, the 8-week class, and I'm going to be going to the info session on the MBSR as well.
Yeah.
But I'm wondering if you could just briefly talk about the I guess the pros and cons, or why
Yeah,
somebody.
yeah.
Yeah.
Yeah, it's a great question. The pathways are very similar, and then there's distinct differences. So at Brown, we aim to do two things. We aim to deliver training to the rigor and the integrity of both programs as they've been researched over 30 and 40 years. And we recognize, and research recognizes, the essential aspect of the teacher's mindfulness practice. So we aim to support the deepening. So both programs require retreats, silent retreats. And in MBCT, we require 3, and they can be taken any point in time before certification. In MBSR, having at least one 5 to 7 day retreat is also a prerequisite in addition to taking the course. So that's one key difference. There's a few more courses in MBSR as well. Zindel Siegel, if you haven't listened to our speaker series that we've been having through the Mindfulness Center, I think you can access them. Let's figure out how to get the people, how those of you that come here, the links to the info series. John Kabat-Zinn was the first. Richie Davidson out of the University of Wisconsin offered the second. Zindel Siegel came for the third. Zindel Siegel described during this, which I thought it was really useful, that with MBSR, mindfulness-based stress reduction. So it's looking at a broader swath of humanity. It's looking at a larger flashlight of suffering that people might experience, stress and distress, and a variety of health-related conditions related to that. MBCT, as the first adaptation, takes that awareness that we're cultivating, and it's like a flashlight into a particular realm of our functioning as human beings, and that's our emotional lives. Really looking at this intimate connection between our thought patterns and our emotional state, how the bodies can support us in our impulses. So for individuals that are eligible for both, one consideration is, where and who do you plan to teach to? If you're looking at a broader population, variety of health conditions, often conditions that are exacerbated by stress, that might be a better path. If you're someone that's a psychotherapist or an educator, and you're also working with cognitive behavioral therapy, although you don't need to be working with cognitive behavioral therapy, MBCT might be appropriate for you, because depression is also, there's been research on MBCT and pain, and MBCT and other conditions. So what I suggest is, like, where do you feel pulled? Like, what feels aligned for you?
Yeah, I mean, it's such a good question. So I run a group practice, and I think to me it's more appealing to be able to offer it to a wide swath of humanity, like you said. And I was drawn to MBCT because of my professional background, of course, but I've really experienced MBSR already and really liked it a lot. So it'll be interesting to go to the other presentation and kind of compare.
Yeah, and then what I will say is, for those MBSR teachers that have gone through the MBSR teacher training pathway and are already starting to teach MBSR, because they're so similar, it can be really tempting to be like, oh, I love that John is walking down the street activity in MBCT. I'm going to throw it into MBSR, but it's out of context. Right? And so it's out of context, and it might not be appropriate for that. For those that might be MBSR teachers, and so you're pretty long towards certification, so you're grounded in that. There isn't,
like, what the heck is going on here?
There is the opportunity to join MBCT teacher training at a later date in an expedited way and coming in at the TAI level. But you have to have been teaching. And we say that because we learned from our colleagues in the UK. They thought, oh, let's let people train in both, or let's let people do both. And what ended up happening is people were mashing up the programs, and the outcomes were really starting to be impacted. And I mentioned our speaker series. It's really terrific, the speaker series. And Karen just put it in the chat that you can go to the YouTube channel And you might want to bookmark that. And then the third speaker was Liz Hoagie, who was talking about research, including her research that looked at MBSR and Lexapro, finding non-superiority, meaning MBSR was equivalent to Lexapro for people with generalized anxiety disorder. Other questions that I've covered to date, and then I just want to talk about the tail end of the program. I mainly want to, people are interested in teaching, so I want to get people there. Okay, if I move on a little bit more. Okay. So then when you look at the full certificate program, this is MBCT. Rebecca, I'll mention some of the differences in MBSR, but you're going to that. So where I left, when last I saw you, we were here at this red square. This is getting to the qualified level. To become certified, you need, what takes a time, you need to teach the full 8-week program a minimum of 4 times. So it all depends on your capacity to teach. There are 2 more courses. We have a course for both pathways. It's a deeper dive into the underpinnings. This is being revised right now. So it's going to be more of an asynchronous course with some online gathering. And then the dialogue and inquiry courses, because both of these programs are experiential and we're not necessarily teaching specifically, we're drawing from the participants' experience with the different practices and their different experiences with awareness. There's a course in dialogue and inquiry. Both programs require mentoring of one of the programs. MBCT will require, their retreats are specifically placed. You need a retreat before you start. You need your second retreat before the TAI. And then you need 2 more retreats before certification. That's MBSR. MBCT, you need 3 retreats, and you just need to complete them before certification. For those of you that are practitioners and you've been on retreat, we typically look at retreats going back 3 years. All right. Questions? Comments? Is it clear? Yeah. How about for those of you that are listening in? If you want to put in chat if you have any questions. I want to make sure that you have a chance to have your questions. And again, I put my email in the chat, patricia_holland@brown.edu. So you're more than welcome to reach out to me individually and just say, can I talk about either about your experience or which program might be best for you? I teach and train in both, but we also have separate info sessions for MBSR. If there's no more questions, then I hope to see you in class one day. And I just want to honor that something in you has been stirred through your own personal mindfulness practice. There's something within you that you're like, oh, this is beneficial and I want to share this. I want to bring this into my work in some way. So I want to strongly encourage you to nourish that in whatever way that unfolds for you. And I want to thank you for your interest in doing that and serving others that way. So thank you. Yeah. See you, Wilson.
Thank you so much.
Yes, thank you.
Thank you.
Yeah, take good care.
You too.
Thank you.
Bye-bye.
Bye.